There's a lot of revisions on 2012. I'm the class of lap band 2012. And I can only speak for my surgery because I had the lap band, right? So within my surgery, all of us are different. All of us are different. We all had a common issue of gaining weight, obesity, maybe not being able to keep it off. Maybe we've been obese all our lives, right? And for the lap band, this weight loss surgery tool was one of the procedures that they did way back when, right? And then they found through the years that it hasn't been that effective for some people. It works for a while. I think the body adjusts. I know my body has adjusted. I only had a 3-month reprieve with the metabolic part of my lap band, and I know exactly when it stopped. I know exactly when the metabolic process was working, and I knew exactly when I had to start to fight, and I've been fighting probably 6 months out. I had the surgery in September of 2012, and probably I've been fighting for 3 months to 6 months after that, right? I think 3 months was my honeymoon. I think I really didn't have to do anything. There was a lot of weight loss there. And then I lost 12, at the end of my 12 months, I plateaued out. My body wouldn't give off any more weight. I lost a total, I went from 215 pounds. I lost 5 pounds pre-op before I went to the bariatric surgeon. I lost 10% of my weight, 10 pounds, before I went on the operating table. And then I lost between approximately 50 pounds with the tool, 55 pounds, somewhere around there. And now, 7 years later, I fluctuate within a 10-pound regain. I go up 10 pounds, I lose 5 pounds, I'll go up 6 pounds. I fluctuate, and I'm stable at 160. That's my set point. That was my post-pregnancy set point in 1986. Let's see, I was, 27 years old. My body likes 160. I may take that set point down, maybe 5 pounds, and I have to work damn hard to get off 5 pounds. It can take me a whole year to get off 6 pounds or 10 pounds or whatever. And then eventually my body, if I eat properly and if I eat what I'm supposed to be eating, if I don't restrict my calories in any way and do no exercise, I will gain 6 to 10 pounds a year. That's just my body. And so I gained from 2004 to 2011. I put on 70 pounds, right? So I got down to a normal BMI, a fat percentage of 15%. You can look back on my videos. My lap band is unfunctioning now, so they found out, well, the lap band is not really a long-term successful tool into managing obesity and metabolic disorders, right? So as Dr. K says, and it's very interesting in what he says, and I'm going to link the card, and I'm going to link the other video. It's called Obesity is Not What You Think by Fatima Cody Stanford. These two videos will give you a clue of some of the pros and cons and some of the body changes that we go through, and who went wrong. Did the surgeon go wrong? Did our anatomy go wrong? Did our hormones go wrong? There's a lot of different reasons, right? We can't just say revision or we failed, or sometimes it's the brain. And as he says right here, Dr. K, and especially in sleep patients, and a lot of lap banders are revised now. There's not many of people that have the lap band left. I only know of, I think maybe four. I'm one of the three that I know that still have a lap band in. And I can't get a revision because I have no insurance. I'm at a normal BMI, and I have no, well, whatever. I'm not, I can't have to go, I would have to gain back another 80 pounds. I would have to gain back 80 pounds, and I'm not going back there. Sorry. So one day if I get money, I might have a revision in Mexico, but I don't have $8,000 in my bank account. So anyway, I'd like to share this with you, what he says, Dr. K.
My bougie is this much, what's yours, and things like that. It really becomes irrelevant.
So what he's saying here, the size of the bougie is irrelevant. Let's hear that again.
The protein breakdown and the protein absorption. It's been studied over and over again that the size of the bougie within a certain limit, it really doesn't matter. So this notion that patients will ask each other, well, my bougie is this much, what's yours, and things like that, it really becomes irrelevant. On a personal experience level, the way I practice is, it is a much better problem to have when a patient comes back and says, I have not lost that last 20 pounds or so, versus a patient that comes back after the duodenal switch or the sleeve, and they have debilitating reflux, or they have significant solid intolerance, both of which mean that the sleeve is made too tight. And as I said, within a sort of broad range, when you look at the outcomes of weight loss surgical procedures, specifically the duodenal switch and the sleeve, there's very little variation between doing the stomach sleeve tight versus very tight versus middle or larger. And we're talking about a bougie size of about 30-something to 40. So patients that are having a sleeve done with a very tight bougie are going to have physiologic problems, and I'll talk about it a few slides later as what it has to do with the pressure and the volume. So on the left.
So there you go. If you have gastric reflux disease, if you have a tight bougie, I think you really want to review this podcast, or if you're considered a revision from a lap band to a sleeve, I think you really need to do your research. Review this video. I'll attach it, and then also review Dr. Stanford Cody, her webinar about obesity, because there's some nuggets that you might find interesting. The procedure that we have on our stomachs is not all 100%, right? It has to do with the foods we eat. It has to do with your movement. It has to do with hormones. It has to do with the brain, the way our hypothalamus, our set point, and the type of foods that we eat. If we're eating sugar, if we're eating cider-filled foods, these procedures, none of it's going to work if you're not evaluating your eating disorder, to be honest with yourself of what you're eating and how you're taking care of your body. So I thank you for your interest. I thank you for your time. Give me a thumbs up if you like. Make a comment, and see you in the next video.